Good morning, everyone. It is Friday, January 7th. Welcome to the Morning Medical Update. By now, you may have heard that Governor Laura Kelly has declared a state of emergency in the state of Kansas. Today, we are going to discuss what this means from a medical standpoint, how this will impact health systems at hospitals across the state and right here in the Kansas City metro area. How will this support staffing, bed space, and patient care? How will all of that be affected? We're going to dive into that. We want you to send in your questions, though, right now. And before we bring in our guests, let's get a check on our numbers this morning from Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson. Good morning to you.
Hi, Jessica and Steve. Not good numbers. Not good numbers. Unfortunately, we've reached the century mark for active infections. Right now, we're up to 100 active infections, with 22 in the ICU, 12 of those on a ventilator, so over 50%. 8 of those 100 active infections are fully vaccinated. We still have 39 additional patients in that recovery period, so a total of 139, but also, Steve, it's on the backdrop of those active infections. We did have 3 deaths over the last 24 hours as well. So
it's a challenge to us, and also to say, Hawkeye, our employee numbers continue to rise too. Today we're up to 957 employees who are out either being tested or with COVID, and so that's a real challenge. And you know, our total workforce is about 13,500. Of those over 100 are nurses who are the backbone of our institution and do so much of the work at the bedside for our sick folks. So, you know, that's a challenge, and we're going to go to our chief medical officers who have joined us today. We are grateful that y'all are here. It's been kind of a short notice, but we wanted to pick up on the themes from Wednesday, continue to hear across the state of Kansas where we are. So we'll ask them what their numbers are in just a moment, but I know we also have to check a couple of other things.
We do, and everything you both just spoke about is exactly why Kansas Governor Laura Kelly has officially declared a state of emergency late yesterday. This happened. This will last 15 days, which she says is intended to give frontline healthcare workers the support they need as they battle this COVID-19 surge. Legislative leaders can extend or end this expansion, but this morning is all dedicated to what can happen over the next 15 days, what this will all mean. So with us this morning, so glad to have Dr. Kim Megow, Chief Medical Officer, HCA Midwest Health. Also, Jennifer Schrimsher, infectious disease physician at Lawrence Hospital and Deputy Public Health Officer for Douglas County. Dr. Kevin Dishman, Chief Medical Officer, Stormont Vail Health in Topeka. Also, Dr. Sam Antonios, Chief Medical Officer, Ascension Via Christi Health in Wichita. And also Dr. Rob Freelove, Chief Medical Officer, Salina Regional Health Center. We are so glad all of you are joining us again here this morning. So first, we do want to ask if there are any reporter questions on the line.
Sherman Smith from the Kansas Reflector. Can you hear me okay?
We can.
Yeah, the governor yesterday talked about the Omicron variant because it has fewer symptoms. She forecast that as it becomes the dominant strain, we would see fewer hospitalizations and deaths, and everybody would kind of be out of the woodwork. Is that the way you guys see this unfolding?
You know, it's not, and here's why. The problem with the Omicron variant is that because it appears to be so much more transmissible, that you, even if you have 4 times the number of infections or twice the number of infections, even if you're half as likely to be hospitalized, but if so many more people are affected at once, then your hospitalization counts still go up. And that's what we're seeing in other areas of the country where the hospital numbers are still rising. And the other part of it is because so many folks, so many staff are sick with Omicron that they can't come in to take care of patients. And so it's a double whammy, right? And so I don't think we're out of the woodwork with Omicron. What we hope is, and what we're going to cross our fingers around, is that as it peaks, and it hasn't reached a peak yet because you can see the map still continuing to rise, as it peaks, maybe it'll have the same rapid fall we saw in South Africa. But we don't know that. That's just hope. That's not reality yet. The reality is we're seeing the highest number of new cases we've ever seen. We're watching hospitalization spike. We're at the highest number of hospitalizations we've seen. What we next have to ask ourselves, what happens to death? Let me ask Dr. Jen Schrimsher, who's one of the infectious disease docs here along with Doc Hawk, if she has any other thoughts. Jen, are we out of the woods?
Oh, no. I mean, our 14-day rolling average for new cases is close to 100 now, and that is well over what we hit at our previous peak in November 2020. So No, we've got the same thing with active cases. We've got more than we ever have. I just looked at my email to see the number of positives we had come in overnight. No, we're still on the upward swing of this. Do I hope it will drop as quickly as it climbed? That is my hope. But we'll have to wait and see, because the U.S. doesn't seem to do things like other countries.
Yeah, and we know we do a lot of modeling here. We try to watch those numbers, see where they go. But Kim, HCA does a lot of modeling too. Dr. Megow, what do you guys see? What do you think is going to happen?
Sure, I agree with Dr. Schrimsher that we're not out of the woods yet. We're very concerned watching our numbers go up, and just a common business saying is hope is not a strategy, right? So we're all here together to come up with something different than hope to try to address the crisis we're facing. But to answer your question, Dr. Stites, yes, we have folks in our company who spend lots of time modeling and forecasting, and it's educated guessing, really, because there are a lot of unknowns still that factor into what's happening. But the most current forecast model includes a peak that actually doubles our current numbers by the early part of February. Now, is that going to be where we go? We don't know. It could be better, it could be worse, but certainly I don't think we're out of the woods. And we continue to watch these numbers each day and try to hone in on better predictive skills, to try to prepare as best we can.
Yeah, I know the folks out in Washington, if you guys remember back at the beginning of the program, the IHME data, they've talked a lot about data throughout the thing. And back when we first had this crisis, the IHME folks were out there trying to make predictions. And they said today that, earlier this week, that the virus has been so unpredictable all along that instead of building 4-week projections, they try to build 1-week projections. And the 1-week projections are not pretty. Dr. Antonios, what's the pressure like down in Wichita? How are y'all doing?
Good morning, Dr. Stites. Yeah, we continue to see the same picture. And, something you mentioned that I think I want to emphasize, a small fraction of a very large number is still a very large number.
Still a large,
and that's
number,
what's concern will be with Omicron. It really is right now a viral blizzard because there's a lot of infections, and we haven't really seen, not yet, any decoupling from the number of cases to the hospitalizations. We hope that would happen. We hope that it ends up being a mild disease, but so far we haven't seen that necessarily. And the other thing that you also mentioned that is important to note is that it is getting a lot of necessary staff that need to be at the bedside, sick and unable to be at work, and that's another factor that's complicating this particular wave as opposed to all the other previous waves.
Yeah, that staff thing's tough. And, as I said, we're nearly 1,000. We'll be over 1,000 tomorrow. And by the end of next week, we could easily be, I don't want to say how high we're going to be because it spooks. By the way, Dr. Antonios, I loved Viral Blizzard. I'm going to steal it. Yeah, so
Stolen.
I wonder if there's other questions out there, Jess.
Yeah, let's get to any other questions. I do have a couple from media, but are any others on the line?
Yeah, this is Dan Cohen at KSHB 41. I wanted to ask about what a Boston ER doctor described as putting circuit breakers back in place, targeted restrictions to flatten the curve, slow the spread. I wanted to know what any of the CMOs on the line thought about that in terms of the idea of quote unquote circuit breakers to slow the spread down.
Yeah, so I think, though, if you think about what is a circuit breaker, in my mind that means masking mandates, and it means closing down businesses and closing down schools and things like that. Here's what I'm going to say. I'm going to turn to some of our other CMOs about this question. Look, we've done this before. We have bent the curve multiple times. We're pretty practiced at it. We know how to do it. Turning off businesses is probably not the best answer. Turning off schools, we heard yesterday, we had the CMH folks on with us, and, not the best answer. Masking works, and I know folks don't like to mask, but I think folks out in Topeka, you guys know, and you made a great statement the other day, Dr. Dishman, on our call about the importance of masking and how we have to get past some of the political rhetoric and just realize the virus doesn't care if you're a Republican, a Democrat, a Missourian, or a Kansan. It doesn't care if you're rich or poor. It just wants you, and the way you prevent that, it's masking, right?
That's absolutely right, Steve, and I appreciate reiterating that. The real key is that the utilization of masks along with vaccination, social distancing, the other things that we talked about extensively the other day, those all are differences that we can make. And if we can simply consider what's safest for our communities and make that our priority, I think we'll move forward as we see both Delta and Omicron together increase the number of cases. We can mitigate that. We can put in circuit breakers, just as you mentioned, but we're going to have to convince people to put aside other concerns and have our primary concern be ensuring that we take every precaution we possibly can. The airline industry is the safest industry, a model of safety. And one of the things that they do is consistently look at how to become safer and make that a habit, make that a part of the culture. And that's really where we are. Our culture needs to be centered around safety and centered around concern for our communities. And once again, Dr. Stites, that goes right back to wearing masks, social distancing, getting vaccinated.
Yep, the rules of infection control, Hawkeye, they continue to travel with us wherever we go. Yeah,
and I will also add in right now for this short term, please rethink about going to any gatherings in the next few weeks. It's okay to stay home. It's okay to be in just your bubble. This will help. Along with those other measures, this is one thing that will help as well.
And I think what's different about this viral blizzard, I'm going to steal it right now, yeah. Dr. I've taken it over. No, but it's really the twin-demic, right? It's both Delta and Omicron at the same time. But the challenge to us, and this is what's going to be a little different. The challenge this time around is that there is such rapid spread of Omicron in the community on top of Delta that we're going to see the ability to staff things drop like a rock. It's not just hospitals that aren't going to be able to staff. It'll be restaurants, it'll be schools, it'll be police force, it'll be the fire. So when you step back and look at it, the way to keep ourselves safe, not only just health, but throughout our entire society and to keep the doors open, is to put a mask back on. Yeah. And I know there's this political rhetoric around masking, but can we just drop it for a minute and just admit that masking works? Yep. Can we just say masking clearly works? And that the way to make sure that things do stay open and we don't shut down the economy, we don't shut down the schools, is to put masks back on. And I think, even out in, I say even, that sounds terrible, but in Salina, y'all, what do you think? Masking, will it work?
Excuse me, of course it'll work. The other parts of the conversation, the closing businesses, closing schools, that sort of thing, you don't really have to talk about it if you can't get past masking. If without masking, those things are going to happen, and it's going to be forced by the virus. It's going to be forced by illness. It's going to be forced by work staff shortages. When you don't have teachers, you can't have school, and if your teachers are out sick, you can't have school. So it all goes back to masking.
Other questions?
And vaccination. If in the last 6 weeks people had gotten vaccinated, that would be pretty helpful as well. But at this point, it's the masking.
Other questions on the line?
Yeah, good morning. It's John Pepitone over at Fox 4 News in Kansas City.
Hey, John.
Hi. The governor seems to have heard you all in issuing this emergency declaration, but I'm wondering, last night, we heard from the legislature, the House Speaker, Ron Reichman, saying that he wants to make sure this emergency declaration is limited to only relieving the regulatory burden on hospitals, and that we don't see any, some of the things you've already talked about, business shutdowns and government mandates, which includes requiring masks. And I'm wondering, I just wanted to ask you if you would share some thoughts, if it's a little disheartening for you as healthcare professionals to learn that we may never see mask requirements again as a tool to fight this pandemic. And I have a second question, if you will allow it.
You bet. So first, let's just say thank you to Governor Kelly and to the political leadership in Topeka. That was a big step, and different than Missouri, where they've tried to declare victory. And which is obviously not true. And so when you look at what Governor Kelly did, that was was a bold move, and we are deeply appreciative of her administration and the legislators' leadership who have supported it thus far, because it does help us. Because one of the big things we can do is take some different types of personnel, retired military, retired paramedics, retired nursing staff, and bring them back to help us run things like the vaccination clinics or the swab clinics, so we can get more testing. I know we're opening up a whole nother testing site on the campus next week, and I think we couldn't do that without that declaration. So that's approximately a very big deal. I'm going to go to our other CMOs in just a minute to get their comments on both parts of your question, John. But the second part of it is, what I'm hearing is something different. Yes, I hear folks say they don't want to have mask mandates, and let's be clear, none of us want to have mask mandates. What we're saying, though, and this is our lane. Our lane is medical care and health care. The health of the public and the ability of people to work is going to be governed by whether or not they can stay free from Omicron and the Delta coronavirus. And so if we can't do that, then schools will close and businesses will close. And that's not the outcome any of us want. So I hear the point that the folks say that, gee, it's politically unpalatable, nobody wants to do it. Right. At that point in time, maybe it doesn't feel very good. But if this thing continues to escalate like it is, I think folks are going to want to put their masks back on because they're going to feel like it keeps them safer. And then the question is whether the political leaders will have the courage to follow that. At the end of the day, what we have to do is keep business open. We have to keep schools open, and you can't do that if you don't have people to work. So, Dr. Megow, thoughts?
Yeah, thank you for your comments, Dr. Stites. I totally agree with what's been said, and I am very appreciative to the governor for issuing that declaration of emergency. I hope that other legislators are listening and maybe willing to extend that if there's a need at the end of this initial period. We certainly appreciate any freedom from regulatory challenges that prevent us from being able to provide care to the patients that come our way. And there are several ways, that this declaration can help us as far as types of staff that we can use, as you mentioned, maybe retirees or folks like that. But let me be clear, that bucket of people is a limited number, and it will help us some, but it is not the end all answer to our problem. If we can't stem the tide of the spread of the illness, we still face the possibility of the closures that you mentioned. And so none of us want mandates. I certainly don't want a mandate, but I also want to be able to have a thriving economy, and I want people not to die from this terrible disease. So we appreciate the support that we've been given from Governor Kelly, and hope that we'll continue to see that come along from all of our legislators in the area.
Dr. Schrimsher.
Yeah, I'm so thankful for Governor Kelly's action. This gives us the freedom to bolster our workforce in the areas as we as a healthcare system need it. I also am surrounded by a community that supports science, and we, had our mask mandate instituted or approved yesterday. I'm losing track of the days this week. We've always been supported by the community. They realize how critical healthcare access is. We also work very closely with all of the area leaders, schools, universities, businesses. We work very closely with these people, and I'm happy, thankful, proud to have their support in a mask mandate in Douglas County.
Absolutely, yeah. All right, let's hear from Dr. Dishman from Stormont Vail.
Again, deepest appreciation to the governor for the order, and I'm gonna agree full-heartedly with my colleagues that that's going to allow us to bring more resources to bear. For 30 years, I've been amazed by the ability of all of the staff in all of our facilities to adapt and overcome. They're doing absolutely everything to care for our communities, and they're doing a great job of it. This is going to add people who are fully credentialed, fully brought on by our medical staff leadership in our facilities throughout the state, and it's going to make a big difference. I'm going to steal something from Dr. Adaiga, who said the other day from the Veterans Administration Hospital. Our job is prevention, and the easiest way to cure somebody of an illness is not to let them get it in the first place. We do that for hypertension. We do that for heart disease. We do that for vascular disease. We watch your cholesterol. We encourage you to maintain a healthy body weight. We're doing the same thing here. What we're attempting to do is encourage every community member in Kansas to take every opportunity to prevent the contraction of this virus. And that will remain, have to remain our focus. Again, the executive order brings more resources to treatment. Again, wearing your mask, getting vaccinated, that's all about prevention. People trust us every day with their high blood pressure, their obesity. This is no different. We're making recommendations that will keep you from getting sick, help you remain healthy, and help to support the amazing medical staffs that we have taking care of all of us across the state every day.
Dr. Antonios, Wichita, or Ascension Via Christi.
I again want to second everybody. I want to thank the governor for the declaration. That certainly will help. Something else I'm going to mention above and beyond what everybody has said is that this is a short-term, hopefully, help for the hospitals that are currently feeling a little bit like they're islands. And so this has put a light on what's going on in hospitals, and hopefully will give us some of the support that we've been asking for. But there's also probably what I would advocate for, a need for some longer term solutions. As what was mentioned a few days ago, our workforce is tired. There's a high degree of burnout, and we need to start thinking about how in the next few months and to few years, we continue support of a workforce so that will continue to be resilient. And I do want to give a big shout out to all our teams that are showing up every day, despite all the adversity, and they're doing excellent work. So thank you for the governor, and thank you for our staff.
All right, and Dr. Rob Freelove, Salina Regional.
Sure. Along with everybody else, I'd like to express gratitude for the actions that Governor Kelly took yesterday, and just for listening and trying to do what she can to help. I think as a couple other people said, these are short-term fixes, and they're Band-Aids on big cuts, but every little thing helps as much as it can, and also express gratitude, I know, for our staff here, but for everybody online and healthcare workers across the state. Somebody said Wednesday, a year ago we were heroes, and now we feel like we're the goats. And I want everybody to know you're still a hero. I mean, you're working in healthcare, you're a hero, and perhaps more heroic now for showing up every day and doing what we do and doing what you do to work through this. So a lot of gratitude, not just to our team and staff here who are amazing with some of the things that people have stepped up and done in the last week as things have built to kind of a crescendo here. But across the state, I know everybody in each of their facilities is seeing the same thing.
Doctor, I think John had a second question.
Did. John, go ahead with your second question.
Yeah, there was some talk Wednesday that the emergency declaration would also open the door for federal aid, specifically military doctors and military healthcare professionals to help care for COVID patients in Kansas and maybe additional facilities. I'm just wondering if you can talk about how close we are to needing that sort of assistance or requesting that sort of help.
Yeah, you bet. I think we're really close. I think we're at the doorstep. We'll hear from some other folks as well, because what's happening is that our ability to take care of patients of all diseases has been limited by the lack of staff. So we have almost 1,000 staff out right now, and that's a challenge, right? Because you got to find people to work, and to the point of these folks have our staff that they keep trying to show up every day, and those folks on the front line, our nursing staff, our respiratory therapy staff, social workers, dietitians. These guys, these folks are doing amazing work to come in every day. We have over 100 COVID positive patients in our hospital alone, and that's a challenge because you still have all your other patients to take care of, and you don't have as many people to do it. So I think folks are exhausted. I think they're often sick right now. It is the flu season. We're seeing a lot of influenza out in the community as well, a lot of rhinovirus in the community. All those things make it more challenging to do that work. So yeah, I think we have to examine this declaration. We have to make sure it gets passed. I think the legislative, I forgot what the next step of committee is, guys. I'm not a politician, so I'll say it wrong, but I think it's the legislative audit committee or whatever. And then we can really take a hard look at that. Dr. Antonius, what are you guys thinking down in Wichita?
Yeah, like you know, I'm not too familiar with the steps that we'll have to go through from a process perspective. And actually, we've got some time set up today to examine some of the details of the declaration, because there are several aspects that I'm not too familiar with right now. Hopefully, we'll bring help, like I mentioned earlier, and like everybody else, it's not the total solution, but it's a step in the right direction. And we're hoping that other leaders are listening and understanding that the need to take action, along with everything else that we've been advocating for the public to be aware of. Right now, it's important to be understanding and appreciative of all the staff that is showing up and doing the hard work.
A few other media questions. Angie with KCTV5 wants to know, could you share your perspective on if we need a declaration of emergency in Missouri?
Yeah, well,
short answer.
I'll turn to Kim's. I know that HCA has a lot of hospitals in Missouri. We just have a little bit of a presence, but the answer to the question really is, I think what you're seeing out in St. Louis when they're canceling a lot of cases, and when Barnes starts to have troubles like that, that's a fine medical organization. That means they're being challenged, and you look at it across the whole country. The idea that we've won because you got, like in Missouri, like 55% of the population vaccinated, I mean, it's just not right. I mean, it's just not true. And I think what we have to do is just be honest about this and quit trying to cover it up with political aphorisms and instead just say, here's what the truth is. The truth is there are a lot of people in Missouri who are getting sick, and there's not a lot of hospital beds, and a lot of the staff are getting sick. And you're being challenged because we heard the other day you can't move patients from an emergency room. We know our colleagues in Excelsior Springs, Missouri are trying to do dialysis in their hospital. They don't have a dialysis machine, so they're trying to make one up. You know what? That doesn't sound like things are going very well to me. So Dr. Megow, I'm thinking that Missouri's decision to declare victory is probably rings a little hollow to those of us in the trenches, and that, I think I'm going to bet that you would welcome a declaration in Missouri.
Yes, certainly we would. And what that would allow us to do is, number one, what we mentioned earlier, is perhaps use staff that are not in the traditional roles that we would normally have, and that would help to improve our staffing. The other piece of that we would be allowed to do is perhaps get patients discharged into long-term acute care facilities or skilled nursing facilities in a more timely fashion. For those of you listening, you may not understand how all that works, but when we have this emergency declaration, it does allow us to move those patients who are ready for discharge into a different facility much quicker, and that frees up beds for us. And again, our staff, to echo Dr. Antonius, our staff is working so hard, and we thank them all for what they're doing. And they will continue to do that, and freeing up beds by getting patients discharged or moved to a lower level of care quicker is one way that an emergency declaration can help us. But certainly we still feel as if we are in an emergency state in both Missouri and Kansas. So yes, that would be welcome.
Yeah, I think the virus forgot that the emergency was over. Right. I think COVID forgot. They just forgot.
Another question from Angie is, what should patients waiting for surgery do? Wanting to know, how should people interpret the governor's orders?
Okay, I'm not sure the question, but here's what I would just say. I think that the folks who have had their surgeries canceled or delayed, in most cases what we call deferred, hang in tight. I mean, we will absolutely get to you, and if your case becomes more urgent or emergent, we're going to get it. We're going to find a way to get it done, because that's what we've been doing, right? And when people are really emergent, we're just going to get it done. And sometimes it's on the backs of our people, but we find a way to get it done. And that's just the challenge. As things get worse and we have more staff out and this disease continues to spread and pressure builds, it will get harder. So I think that may be that'll be a challenge. I don't know, Dr. Dishman, other thoughts you might have?
I think one thing, Dr. Stites, I'll echo what you said, in assuring everyone that a clinical assessment is done on each of these patients and ensuring that that the procedures that need to get done, let me just say again, we will find a way, as you said, Steve, and because that's what we've been doing, and we'll continue to do that. The important thing, I think, is to have an open communication with your physician, with your surgeon, with your primary care physician, and ensure that you're having that communication about what your situation is, so that if the situation does change, the clinical management may change. So I think the important thing that people who are waiting for their surgery can do is continue to have that close relationship with their primary care physician and their surgeon to ensure that we're staying up to date on their status.
Dr. Freelove, I'm thinking Salina, there's not, I mean, people who need surgery in Salina, they don't have lots of choices of where to go. So, I mean, you guys, you're it. And so when, I know you're going to be faced with the same dilemma. How do you make sure these people get the cases when they need to get them?
Yeah, in fact, we had to take some measures yesterday to defer some elective screenings over the next week, and had to postpone some elective surgeries next week that require an overnight stay. And you know, every day I encourage our surgeons to go through that list, communicate with those patients, make sure that they're following them clinically very closely, because at some point in time, what we might deem elective is probably going to become urgent. And God forbid, we don't want it to go from urgent to emergent when we could have intervened at urgent. So same thing. We try to find ways, and we've gotten creative a few times, and we've had some good partnerships with some of the critical access hospitals around us who've helped us with moving patients and creating room and space here so that we can get some things done. But you know, what can they do? They be patient. Do what you can to avoid getting ill yourself, and helping stop that spread, and keep that communication open with your physicians.
Dr. Stites, a follow-up to that question is, what do you want people at home to do if they need to drive themselves to the hospital? Are they supposed to go to urgent care? What could help out?
Yeah, well, so the first thing you got to do is make sure, as one of our colleagues just said, you got to talk to your primary care physician and say, hey, what's my next step, right? Don't try and decide it all on your own. Okay. Get a hold of your primary care physician, get a hold of your surgeon if it's a surgical question, and say, hey, what do you want me to take as my next step? Secondly, if you're acutely ill and you need help, you just got to go to the emergency room, right? I mean, urgent care is great for an ankle a sprain, or less kind of what we would call a subacute illness. I got a cold, I have the flu, etc. But if you think you're having chest pain, you're worried about having a heart attack or a stroke, or you're having you fractured your leg or whatever, you just got to get to the emergency room, and we're going to help you. We can apply triage criteria, and we may have folks in beds in the hallways, but we will find a way to get you taken care of. And the more serious it is, the more seriously you need to get to the hospital. So don't delay trying to get necessary care if you're really injured or ill, because that may make things harder. You're still going to end up in our emergency room. You're just going to be sicker when you get here, and that's going to be more complicated, not less complicated.
So Allison from the Kansas City Star wants to know, what specifically will this new order from the governor mean as far as what will day-to-day operations look like over the next 15 days? What will those 15 days do? And compare that to what we were looking at yesterday compared to what we could look like in the next week or so.
So I'll tell you what we're going to do. We have some retired folks who used to be here, and they don't maintain their licensure because they're retired. We're able to bring those folks back, and we've done that before, and that was really helpful. We can turn to the School of Medicine and School of Nursing. We're having those conversations and say, okay, folks, are there some people that can come over and help us in a swab, help us run our swab clinic or our vaccination clinic? Are there people who can come over and help us stock shelves and things like that? Because we can now use different kinds of personnel in different positions. Those are enormously helpful and take the burden a little off the frontline staff. But what we would really like, we really want to make sure we get our swab clinic and our vaccination clinic staffed as best we can without having to cancel clinics. At the end of the day, the number of people out sick may outstrip the number of people who can come to help us, but the more that we can get the help, the fewer things we have to not do. So, Samir, what are you guys doing in Wichita with it?
Similar actions, Dr. Stites. So like I said, there's maybe some of the details that we're not completely familiar with, but we'll discover that today and then sort of put some of those actions in place. And, the other thing that I want to, I guess, reemphasize something you did mention, it was very important about people not skipping on seeking help if they're having symptoms. We do know from last year, when the pandemic first started in 2020, a lot of people were having strokes or chest pain and heart attacks, avoided going to the ED, and that did lead to a secondary pandemic. And so we definitely don't want that to be the message, and we want people to understand that we will do whatever it takes to take care of them. I guess the only maybe small caveat I would add to that is the only reason for someone to seek go to the emergency is for testing and no other symptoms, just to get tested. Maybe the emergency room is not the best place for that, and I would recommend people go somewhere else for testing. But otherwise, the symptoms, we want to avoid a secondary pandemic and reemphasize what you mentioned about the seeking care and talking to their doctors.
Yeah. Kim, what do you think it'll mean for HCA?
Much the same as what you said, Steve. Will allow us to use additional staff and perhaps non-traditional roles, even medical students and residents who can help out with swabbing clinics, as you mentioned. That's really the quickest thing that we can do to take advantage of this declaration.
Yeah.
I'd like to get to a few community questions if we
Please.
all have time. And the first one's from Glenn, and I'm glad he asked it because this question's been asked several times. So I'm going to ask you to tell us what it means and then why it would be important. So he's wondering if our local hospital groups are going to follow New York's lead and begin reporting patient numbers of admitted with COVID versus admitted because of COVID. Basically detailing why someone is in the hospital. So that's come up a lot. What is that? And why would that matter?
So, okay, this is we have to comb through this one a little bit more thoroughly. So when there was a time where we were doing admission testing on COVID, and by the way, our numbers are about 90% admitted with COVID, and because of COVID, just to be clear.
So it's the same?
No. When we did screening on every single surgical case, some of those would be positive, but they're here for surgery, and they were just positive and asymptomatic or whatever. And so then that would still be a COVID positive patient, and we would still report that. Now, but the thing is, we've stopped doing as much screening because we had to have tests for getting everybody tested who's acutely ill. So by not screening, we don't have that same number. We probably have more cases in our hospital than we're reporting right now because we're not doing as much screening of admissions. Now we do screen once you get in the hospital, we'll do it, but it gets wonky around surgical cases because surgical cases, if they're going to be admitted for 4 or 5 days, we'll still test them. But if they're just being admitted overnight, we may not test them. And so this gets really, it's like a fine-tooth comb here to try and separate out how it is. But what I can tell you is that over 90% of our patients who are being admitted with COVID, it's because Hawkeye, they have COVID.
Yeah, and that's the issue too. Is we've had to open up other units. So our cohort units for our active infections, we've had to open up other units because of this in recent weeks. Those people are all here because of COVID itself.
And they're all sick.
So, yes.
Right, they're ill.
Absolutely.
Yep.
So I think it's a valid question. I think there are and there have been people who were admitted and we found it incidentally. Who didn't have symptoms, but that's not the case currently. And just as you said, Steve, 90% or more are here actually because of COVID, because of symptomatic disease.
Yeah, Dr. Schrimsher, thoughts about this, and especially from an infectious disease standpoint, sometimes this is a hard differential to make because even somebody who's positive and may not really have, quote, COVID, may still be mildly symptomatic with COVID.
Yeah, I have pushed against that for two reasons. One is these COVID positive patients we call them incidentally positive. They still utilize different staff. They still utilize different PPE. We have to open up different rooms, negative air, open up our COVID unit, or other flex units. So I think it's important to report out that number because it is still impacting our healthcare system. The other reason is I don't know that we can say, if I have a 90-year-old female admitted for altered mental status, that her altered mental status is not due to COVID. I don't think that we can say that for a lot of conditions. So I continue to think that it's important to report that as a whole number. And we're still testing all our pre-ops and we're still testing all our admissions. So yeah, I just haven't thought that that was appropriate to separate out. And sometimes we don't have very many, like early November, we had one COVID admission. I don't think in a community this size, it's appropriate to report whether or not that person was here for COVID or not.
Yeah, so honestly, this is a distinction without a difference. Because the reality is that you mean, go ahead.
Yeah, if I may add something also to this, we don't have testing across the board on everybody who walks into our doors just because we are trying to preserve the testing supplies. And so whenever we are testing people, it's because generally there's a clinical indication someone is having symptom. And so with us, we have a high confidence that whatever we're reporting are true patients with true COVID-19 disease as opposed to incidental COVID-19 positivity, at least to a large extent. There might be a few cases here and there. The other thing I want to add is it does take time to try to tease out those two differences. And to your point, Dr. Stites, I don't know if it brings a lot of value. We're trying to streamline the process, trying to spend more time to ask questions and ask someone to differentiate and log into the EHR and document on some field, whether this is with or this is because, is just added work that doesn't really bring a lot of value. In the end, like you heard, at least for the majority, these are symptomatic patients, and we would still need to isolate them. They would still require the PPE. And so I'm not really sure what else it would make a difference as trying to collect some of that data.
Yeah, I think it's from some of those, some of the MUNs, the made-up news networks, trying to say, oh, it's really not that bad because these people really aren't here because of COVID. Well, okay, where's my little wrong gong here? Because that is just not the case. The problem we're struggling with is that we have too many symptomatic COVID patients and we have too many symptomatic staff who are out, and so we can't take care of all the patients. And you know what? That's not made up.
It continues to be, opinions that are not fully informed from the actual reality, the actual data that's out there.
Couple more questions, and on that note, Janet is asking, with all of the staff out with COVID, do we know where they're getting it from?
It's just everywhere in the community, right? I think, I think you watch everybody shake their head. Yeah, it's just everywhere, right, Hawk? I mean, no matter where you go, you may as well expect COVID to be there. In fact, we've come to be saying COVID, it's everywhere you want to be.
But I could tell you where it's not and where they aren't getting it. That's in the health system, in our building, in those areas that we have, because everybody is being masked. Care providers have masks, have goggles, have eye protection. So the place that they're not getting it and we aren't seeing infections arise is in the hospital itself.
Okay, so we have one more question from media from KCTV5. What about swabbing throats with those at-home kits? If most of the symptoms are in the throat, would it help to swab the throat?
Dr. Schrimsher, what do you think about throat swabbing?
That's a longer answer. I believe most of the tests were validated for nasopharyngeal. Respiratory viruses tend to replicate in those tissues more efficiently. I heard something the other day about Omicron being perhaps more detectable by saliva than the nasopharyngeal swab. I haven't read that data yet, but I'm not sure of the purpose. I mean, we have validated nasal swabs, anterior nares. So, I mean, it's not invasive. I don't know.
And you're not, just because that's where you have symptoms may not be where your virus necessarily is, Hawkeye.
Yeah, I mean, I can't echo what Dr. Schrimsher said anymore. I believe that exactly what she says. So.
All right, we're going to wrap up today. I know all you have to get back to work, and we really appreciate all of you joining us today. I know you feel the same.
Yeah, I just want to say thank you. So we put this together last night, and all these folks have rallied to it. We want to make sure we expressed our appreciation for the emergency declaration, B, expressed our concern that the crisis is going to continue to rise, and C, that this is not made up. And I think you've heard it from all of our team here today. We're all on the same team, right? We may be in different hospitals. We could be incredibly competitive with each other. But you know what? We have a common enemy now, and we are on the same team. And these are great people. These are great hospitals. They have great staffs across our region dedicated to trying to take care of COVID-19. So a special shout out and a special big thank you to all the folks out there who are taking action to help support what's going on inside a hospital, support the public. This is what we have to remember. During this crisis, and you've heard us say this before, the enemy is not each other. It's not a Republican. It's not a Democrat. It's not a Jayhawk. It's not a Wildcat. It's not a Tiger. It's not each other. The enemy is within, and it's twofold. First, it's the virus, right? Because the virus is the enemy. And the second enemy is dishonesty. Because if we don't tell the truth, and if we don't just be open and honest about things, then we can't have a conversation that allows us to take on the enemy within, SARS-CoV-2. So let's remember that together we're on the same team, and the real enemy in the room is this damn virus. And the way to beat it is by taking that seriously and following the rules of infection control. Wear your mask, keep your distance, don't go out if you're sick, get vaccinated. We can win. But we can only win if we can stand together and not stand against each other.
Well said, and thank you to all of our guests. Dr. Hawkinson, you're going to get the final thought today. What's your message as we head out? Vaccinate.
You know, these opinions that are uninformed by science and data, we know what can protect you. And we heard a little bit with the emergency order. That's going to help protect our community. You can also protect yourself individually, your bubble, your loved ones and friends, and that is by getting vaccination. Getting the booster if you meet that criteria and you are time out from your second dose. These things do work. We have good validated studies. CDC just published a recent study today or yesterday showing that is in fact true. So it's really all about vaccination.
Thank you so much, and thank you all for being with us today. Coming up Monday, we continue to follow Omicron and the COVID case numbers closely. In fact, our numbers gal, Dr. Amber Schmidtke, is back with us. We'll discuss what the recent surge shows and what the next few weeks may look like as cases continue to rise and put massive strain on our healthcare systems and our staff. We're going to take your COVID questions and update you on our patient numbers. So everyone, have a great Friday, have a great weekend, and we'll see you back here Monday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.